Hey, I'm Andrea, nurse practitioner at Grace Optimal Wellness. I am so excited that you scheduled your new patient consultation, and I just want to talk to you about some hormones and our method here at Grace Optimal Wellness. Jot down questions that you may have after watching this video and bring them into your new patient consultation, and we will get those answered for you. I look forward to working with you and getting you to feel like a better you. I want to talk about my history so that you know how I ended up starting Grace Optimal Wellness. So in 2000, I graduated from Vanderbilt University as a certified nurse midwife, and I worked as a nurse midwife for several years until I went back and did a postmaster's family practice. In 2017, I started a primary care and gynecology office. And I started to notice over the years that the majority of my patients were 35 to 60 and female. And they all seemed to complain of the same thing: chronic fatigue, trouble losing belly fat, hot flashes, night sweats, vaginal dryness, decreased sex drive, brain fog. You walk into a room and you forget why you walked into the room, and you would write all these post-it notes down and then you lose the post-it notes. And so it's the same thing over and over. And from a traditional medicine standpoint, I could check the labs, and for the most part, they were normal, but they didn't change that they were still so miserable. And this is when I started looking into integrative and functional medicine. I had my own stressors that I had been through myself. My first husband passed away, and then both of my parents passed away from cancer. I bought out a business partner and had stress from that, and then I was running a practice by myself. And so there were so many things that were going on that were causing stress for myself. And so my weight went the highest it's ever been. And so this is actually a picture of me on the left. It's in 2021. And this was when I had so much stress. I was working out 5 days a week. I'd get up at 4:30 in the morning and go to the gym. And I didn't feel like my diet was perfect, but it really wasn't that bad. And so I could not get rid of my belly fat. And so that was when I decided, okay, I've got to get control of this. And this is when I was introduced to the BHRT Academy and started my love for integrative medicine. So you can see that, I have lost a significant amount of weight. Some of it was through the grief and stress of losing both of my parents. And part of it was I did use some medications, but then the majority of it came off when I balanced my gut health and my hormones. And so I didn't realize really how much was going on until I started feeling good. And honestly, at this point in my life, I feel physically better than I have in my entire life. And it's because I've learned how to correct food issues and worked on my nutrition and getting exercise. My sleep is improving and my hormones are balanced. I want you to feel better. I want you to be motivated to get up and go to the gym, or to see that change in yourself, that you feel like you're the best you've ever been. At Grace Optimal Wellness, we have 5 pillars of health. First is gut health. Second is to rebalance your hormones. And then we activate your metabolism to help you lose weight. And we clear those toxins and empower a healthy lifestyle. And so your gut is your second brain, and an imbalance will affect your entire body, whether it's trouble losing weight, brain fog, trouble with hormones being balanced. Your hormones depend on what's going on in your gut. So much of our health starts in our gut and how you digest and absorb the vitamins and the minerals in your food that you eat to help you make your hormones. Most of our immune system lives in our gut. Irritable bowel, bloating, heartburn, all of these things are so common. But if you've got heartburn, it's not a pepsid deficiency. There's a problem in the gut, and we need to figure out why. So rebalancing hormones. Your hormones affect who you are on the inside, how you react to the world around you, and how you relate to others. Whether you burn fat, whether you store fat, how your immune system works, they're regulating chemicals that impact so many factors in your body. We want to activate your metabolism. Let's get regular exercise. Let's do some weight training. Let's add some muscle mass so that you can burn calories at rest. Eat fat-burning foods. Get a good night's rest. These are all things that are going to help to activate your metabolism. We want to clear your toxins. This is an important pillar to think about, and how well your body will detoxify from all these toxins that are in our environment. A lot of these chemicals are hormone disruptors. They mess up the way your hormones work. And I assure you that the majority of traditional medical providers are not for 1 millisecond thinking about the toxins in your environment and how they are affecting your body and your symptoms. And then the fifth pillar of health is your lifestyle habits. We can't avoid this one. You can't supplement yourself out of bad lifestyle habits, but it's a two-way street. If you're exhausted, if you're living in survival mode, it is hard to feel like chopping your broccoli or going for a walk. We need to think about you as a whole person, because each factor is necessary to getting you to feel like a better you. All right, so let's first talk about estrogen. Estrogen is important to help you with the symptoms that you're having right now, whether it's hot flashes, night sweats, vaginal dryness, decreased sex drive, but there's also that long-term benefit. So it's going to decrease your risk of Alzheimer's, decrease cardiovascular disease, and decrease risk of osteoporosis. So these are things that you will get long-term benefits for. And so patients will say, how long do I need to stay on bioidentical hormones? And my answer is going to be, how long do you want the benefits? So it is something that we look at for a long-term treatment plan. The decline in estrogen can be very erratic. A lot of times women will come into my primary care office and say that they feel like they're on an emotional roller coaster. Today they like their husband, tomorrow they don't. And it's just all over the place. Crying at Toyota commercials. And so low estrogen equals hot flashes, vaginal dryness, memory problems. This is part of that. You walk into a room and forget why you walked into the room, and brain fog. It also helps with moisture. So it helps hold on to that, whether it's preventing dry eyes, dry hair, or vaginal dryness. So estrogen is a natural antidepressant. So when people say, I'm 42 and I'm starting to get depression for the first time, I've never been depressed. I don't feel like I have things to be depressed about. It may be your estrogen. You may be starting to wax and wane with those levels. And so there's things that we can do to help you with that. So estrogen also improves your carbohydrate metabolism. It will reduce the pore size in your skin. It decreases the frequency of urinary tract infections, and it helps to maintain muscle and to increase energy. So progesterone, this is probably my favorite hormone. This is the one that starts to decline about age 35. Women come in all the time, all of a sudden having episodes of anxiety or trouble sleeping. It's a natural anti-anxiety hormone. It's the calming hormone. It's what brings you down when you are getting so worked up and your teenage children are just driving you bonkers, or you feel like everybody's just getting on your nerves. So this will help to kind of bring everything down, and you don't feel like you're responding so rapidly or just so rapid fire with everything. It is usually the first hormone that starts to decline. Like I said, it's about age 35. Deficiencies are associated with anxiety, irritability, and poor sleep. It helps your thyroid to function properly, and it may also help with your sex drive or libido. It helps prevent hair loss and hair thinning. So as we get older, a lot of times women will say, I'm starting to lose all my hair, and this may very well be a part of that. It's a natural diuretic, which helps to flush out any excess fluid. It helps to mood, your brain, and breast protection. Progesterone helps estrogen to metabolize down the healthiest pathway. It also helps with fibrocystic breasts as well as fibromyalgia. It will help to increase exercise endurance, and it reduces PMS symptoms. So next we're going to talk about testosterone. So this is a male hormone. It's what everybody comes in and says. Yeah, it is a male hormone. However, women need testosterone as well. It starts to decline gradually. And so by the age of 40, it may be 50% of what it was when you were in your 20s. So remember back when you were in your 20s and you wanted to have sex all the time, and then now you're 40 and you have no desire, it may very well be because of a decline in your testosterone. Testosterone helps to keep muscles and bones strong. It helps with that sagging, crepey skin. It also helps with the oil of the skin, the hair, and the vagina. So it has everything to do with sex, whether it's your desire, your arousal, the lubrication, or the ability to actually have an orgasm. But this is a balancing act, because if we give you too much or you have too much testosterone, then you end up with the side effects of, losing your hair, becoming the bearded lady, or getting acne. And so it's a balancing act in making sure that you're at your right level so that you feel your best. When your testosterone is low, a lot of times people will say that they procrastinate. They just don't feel like doing it, whether it's your laundry, whatever it is, getting up and going to work. It's just a struggle to do anything. And so these are things that we can work on in balancing your hormones. So testosterone also helps to lower your cholesterol. It helps to improve your memory and sex drive and a sense of well-being. It also helps to increase energy. It can help increase bone mineral density and reduce the risk of fractures. Also, as we get older, a lot of women will say that they start to leak urine, and this can actually help with that urinary incontinence. So this is another big hormone. This is our stress hormone, which is cortisol. So cortisol helps us to cope with stress. So imagine driving down the street and somebody pulling out in front of you, and you get that immediate fight or flight response. Heart rate goes up, you kind of panic, and it goes away in a few minutes when you realize that the threat has been removed and everything calms down. But imagine if you have that kind of response chronically, and it's just repetitively, whether it's a physical pain or an emotional stressor. And so those are things that we've got to work on to correct so that you feel better, that you start sleeping through the night. Prolonged stress can cause the elevation in your cortisol. And so when somebody has that chronically elevated cortisol, they will have that belly fat that it doesn't go away. No matter what you do, no matter what workout, how many days a week, you get a trainer, you try all these fad diets, it just doesn't go away. It's because it's a lifestyle thing. It's a stressor. We've got to correct the underlying issue to begin to see improvement. Women will also complain of having trouble sleeping. So you may wake up at 2, 3 o'clock in the morning, and for no reason, it's like your own little internal alarm clock, and it's where that spike in your cortisol's making you wake up. And you lay there and you toss and turn, and then the hamster starts running on the wheel, and you start thinking about things and you just can't fall back asleep. A lot of times that's connected to your stress hormones. You may have some mood changes, some anxiety or depression. You may also notice that you have a lot of food cravings, or that you're starting to see some changes to your blood pressure, or you notice that your blood sugar has gone up. You've recently had a complete physical and you're starting to see, okay, there's glucose. You're not a diabetic, but you're starting to see some low increases. Cortisol will help to regulate your hormones, your immune system, and your blood sugar. When the cortisol is elevated, you can have worsening symptoms of menopause. So it's very important for us to get your cortisol levels in balance as well. All right, so this next slide, if you look at the graph, you see that at 3, this was mine. This was when I was learning how to balance hormones and doing all of my training. I did all this testing on myself. And so I was struggling with that chronic stress and was waking up at 3 o'clock every morning, could not go back to sleep for any reason. Well, when I did my testing, you can see at 3 a.m., when I did my first saliva collection, it was extremely elevated. And that's why I was waking up. And then the rest of the day, I did pretty good. But that's when I was getting that big spike. So your cortisol has a natural circadian rhythm. So we want everybody to have a little bit of a spike in your cortisol between 6 and 9 o'clock. This is going to help you to, when your alarm clock goes off, that you're not hitting snooze multiple times before you actually get up. You wake up and you get up and you feel refreshed and you feel like you've had a good night's sleep. And so when you're out of balance, we have trouble getting out of bed. You wake up, maybe you need to get a couple of cups of coffee to get you going, or maybe in the afternoon you have a crash and burn where you need some sugar or some caffeine in order to get through the afternoon. And you'll often get your second wind about 10 o'clock at night. And some women will say, I get more laundry done and the house clean and things for work. I get everything done right before bed. And then I'm so wound up, I can't fall asleep, or it takes me forever to fall asleep. I can write you a prescription for hormones, and it will likely help your menopausal symptoms. But if we don't address the cortisol, we will never get you all the way there. And so cortisol helps all of the other hormones work together. So let's talk about thyroid hormones. This is something that patients will come and see me as a primary care provider and say, I have all of these symptoms of a thyroid dysfunction. Can you check my labs? And so we check the labs and, here's that normal range. Well, guess what? They are right in the bottom. But you'll be told by primary care providers, because that's how you're trained, it is that they are normal labs. You don't have a thyroid abnormality. But when we're looking at labs from an integrative medicine or a functional medicine, we're not looking at this critical disease labs. We want to tighten it so that we want you to have optimal wellness. And so what may be considered normal way over here with the very bottom of the range is not remotely normal when we look at a much tighter reference range. And so hormone imbalances will interfere with the thyroid's efficiency. It will give you slow metabolism, often have trouble losing weight. It's important to get your gut moving. Often people will say that they have problems with constipation or that they always feel cold. Thyroid controls brain health, mood, memory, energy, and guess what? Sex drive again. So all of these factors work together in order to help you feel better. High cholesterol may also be a symptom of low thyroid. Cortisol, deficiency in nutrients, and inflammation affect how the thyroid functions. There is an interplay between all hormones. Female hormones, estrogen, progesterone, testosterone, your stress hormones, which is your cortisol, and your thyroid hormones. These are all things that we are looking to balance so that we can get you to feel like a better you. So we also want to look at food sensitivities. So a food sensitivity can arise at any point in time in your life. It affects your digestive system. It occurs when your digestive system is not breaking down certain foods. It can be exacerbated by many factors such as stress, gut, lack of diversity in your diet, or gut imbalance. And so emotional stress and physical stress can also affect food sensitivities. Now, this doesn't mean that you're allergic to a food. It's just saying that there is a negative response when you ingest this. And so we will work with you towards eliminating these food sensitivities for a period of time so that we can help to heal the gut and then we will reintroduce those back into your diet. Now, when you go to reintroduce some of them, there may be a food that you're like, okay, I don't like that response, or that really is causing a lot of bloating and it's just not worth it. And so you may choose to further eliminate that, or you may reintroduce a food and be like, okay, I can tolerate that. I had belching or bloating previously when I had that, and you heal the gut, and then that doesn't happen anymore. And so we also look at gut health. Your gut will always harbor some bacteria, but you want to have the right balance of the gut flora and the good bacteria versus the bad bacteria. So your gut's considered, you may have heard this, that it's your second brain. So if your gut is out of balance, you may have bloating, you may have joint pain or stiffness, or you just really feel inflamed. You may have brain fog, depression, anxiety, trouble losing weight. And so all of these things will help when we start working through supplements and through nutrition to help heal your gut so that we can heal you. So a lot of people will ask, what is integrative medicine? So we're looking for the root cause. We're looking for what is causing you to have your symptoms. This is a quote from Medicare guidelines, and it says, a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or a therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed not medically necessary. This is meaning things like looking at the root cause are not considered medically necessary. Sometimes I wonder, would insurance companies rather take care of prevention and finding something early, or would they rather take care of a stroke or a heart attack down the road? And some insurances, it's going to be that they would take care of the stroke or the heart attack versus anything prevention. And so we are looking through integrative medicine at the root cause of what's going on. Our goal is to get you to feel like a better you. Are you ready to change? You previously talked to my patient care coordinator, and they told you about how we are here at Grace Optimal Wellness, how we do things through programs, and we're looking for the root cause, and we're looking to get you to feel like a better you. My mentor has the phrase, when the pain of staying the same is worse than the effort required to change, that's when you will make the change. This isn't a quick fix. We are looking at making lifestyle changes. We are looking at balancing your hormones and correcting gut health and food sensitivities and looking for that root cause so that we can help you to feel like a better you. I look forward to meeting you at your new patient consultation. So please jot down any message or any notes or questions that you may have. Watch this video again, and then when I see you at your appointment, we can address any of your concerns or issues, or I can elaborate on anything that you have questions on, and I look forward to it. So I'll see you soon.